The February 23rd, 2016 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mrs. Brown? Here. Dr. Carbone? Here. Mrs. Conley? Here. Mrs. Draw? Here. Ms. Harris? Here. Mr. Hebert? Here. Ms. Cayley? Here. Mr. Lightfoot? Here. Chairwoman Taylor?
Here. Is there anyone signed up for the public forum?
There is not.
Is there anyone present who is not signed up to speak who would like to address the committee at this time? Okay. Being none, the next item on the agenda is the approval of minutes. You have the January 26, 2016 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 16-0093, accept.
Moved by Legislator Brown, seconded by Legislator Conley. Is there any discussion? Legislator Harris?
To the administration, through the chair, this will be an increase. This will increase the analytical capacity and decrease the turnaround times, and other goals as well. Is the office fully staffed?
Through the chair, I think Dr. Bino is in the back of the room. She should answer this question.
Through the chair, could you please repeat the question?
Oh. This grant is for about $21,000, and it's the 13th year receiving the grant. This will increase the analytical capacity and decrease turnaround times and other goals as well, as we can see. Is the office fully staffed at this time? Thank you. Through the chair, to the administration, is there also a backlog of cases currently?
Okay. Through the chair, yes. The toxicology analyzes post-mortem toxicology samples, driving impairment. For driving under the influence of drugs, driving impairment, driving under the influence of alcohol samples, and samples in cases of drug-facilitated sexual assault. So backlog being defined as cases that are older than 30 days. We tend to run a backlog in post-mortem cases of anywhere from 50 to 100 cases. And in terms of drugged driving cases, we tend to run a backlog of 40 to 50 cases. We do not run a backlog of alcohol impaired driving cases, and we tend not to run a backlog of drug-facilitated sexual assault cases.
Thank you. I have one last question through the chair to the administration. How does that information that you just gave me compared to the trend from recent years?
Well, in some ways, it's not a direct comparison because our caseload has increased steadily every year. So for the past 5 or 6 years, our driving impairment in terms of driving under the influence of drugs cases has increased in the range of 10 to 15% per year. And last year, we had approximately 10% increase in our autopsy cases, so postmortem toxicology cases. So we had a total of 1,031 postmortem toxicology cases submitted to the lab in 2015, and 481 drugged driving cases submitted. So our backlog is actually doing somewhat better because we've been conducting Lean Six Sigma processes in the laboratory. So we're not getting further behind, but we're getting more and more cases. So there's this balance going on.
Thank you very much, Madam Chair. Thank you.
Is there any other discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 16-0094.
Moved by Legislator Conley, second by Legislator Hebert. Is there any discussion? Legislator Harris?
Madam Chair, to the administration, through the chair, let's see. Wouldn't it be reasonable to assume that the costs associated with this grant will remain flat for each of the years? Can I ask?
Good evening. Through the chair, the reason that assumption wouldn't be accurate is because children are enrolled on a continual basis. They can be referred at any time throughout the year, and they can be found eligible at any time throughout the year. So that's why we see changes in the number of children eligible for the program each year.
Thank you. I have another question to the administration through the chair. Is the $25.7 million a bulk total estimate, or are these estimates for each of the vendors? And if so, if you can please break down vendor by vendor what exists for each vendor by year.
Through the chair, I can't provide numbers per vendor because it all depends on their caseload, which also is always fluctuating, as well as the frequency of and type of service that the children are providing.
Thank you, Madam Chair.
You're welcome.
Yeah.
Legislator Canley?
Thank you, Madam Chair. If I might, through you to the administration, is it the case where the list of the approved vendors at any given time, one or more of the vendors might not have a caseload? So in other words, we have a number of vendors here and they're on standby?
Through the chair, actually they all carry a caseload. It does vary in size, but at no time are any of them not providing services.
All right, thank you. And then can we assume that those that are within a particular footprint or area are capable of handling a fluctuation if there are changes during the year?
The providers are, by contract, required to provide services throughout the entire county. However, they also have the latitude to accept or decline a referral that is made to them. So there are periods of time in the program throughout the year where capacity is an issue.
Thank you. And then just speaking to that, I didn't realize that. Thank you. Through the chair. Would there be another vendor that would be able to handle that case in the same location that they might have been refused by the first vendor?
There is a process in place where, in this case of preschool providers, the CPSE chairs, who are the ones that secure the providers, that stands for Committee on Preschool Special Education, they're the ones that determine services and select the providers. So there's a process that they go through to exhaust the list of providers, and then if there are not any providers, those children do need to go on a waiting list for services.
Could I ask, thank you through the chair, in the last year, did we have an approximate number of how many students might have been on a waiting list?
Through the chair, the districts would have that level of information. They maintain that since they're responsible for securing the service providers. If I had to hazard a guess based on information that is shared with me, I would say there's at least 50 children on a waiting list for speech therapy. That is the primary discipline that we have in shortest supply at the moment.
Thank you. That's it.
Any other discussion? Legislator Conley?
Thank you through the chair to the administration. Can you talk a little bit about the relationship between the county and the individual school districts as it relates to the Committee on Preschool Special Education in terms of it's the committee's recommendation if services are needed, but then the county actually pays for the services, if I'm understanding that correctly?
Through the chair, that's correct. The Committee on Preschool Special Education determines what services the child will receive, and the county's responsibility is to secure the providers that deliver the services and to pay for those services. We do have 3 municipal reps who attend as many meetings as they are able to represent the municipality at those meetings.
Thank you. And through the chair, are some of the services that the children receive between the ages of 3 to 5, are some of those services actually provided in the home, or are all of the services provided in a school setting?
Through the chair, services can be provided in either setting. I would say in the majority of cases, services are provided within a preschool setting, whether that's a special class or special class integrated, or even a private preschool. Services are provided primarily there, but some kids don't go to a preschool, so in those cases, services are provided at home.
Thank you. And Madam Chairman, I just wanted to support enthusiastically this funding. My son, who is 7, is a successful graduate of the early intervention program and the Committee on Preschool Special Education services that were provided through this program, which were invaluable to him finding success in school, and I'm very grateful for these services. So I want to thank the administration and thank legislators for supporting this program.
Thank you, Legislator Conley. Is there any other discussion? Being none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 16-0095, authorized contracts for pediatric services provided by the Monroe County Department of Public Health, Starlight Pediatrics
Moved by
Clinic.
Legislator Hebert, seconded by Legislator Draw. Is there any discussion? Legislator Lightfoot?
Thank you, Madam Chairman. Through you, Madam, to the administration. Can you help me to understand this particular referral? It appears, as I read it, are we providing the service to the foster care? Is it Monroe County seeking reimbursement, or are these two companies bringing participants to our facilities? Or I'm just not quite clearly getting all the gist of it. Through you, Madam Chair.
Through the chair, we provide, Starlight Pediatrics provides medical care, pediatric care to these children who are foster children in Monroe County. The therapeutic foster program is a higher level of foster care provided in specially trained foster homes, and it's conducted by Hillside Children's Center and by the NAFI, which is, they have special training and they provide special intensive support services for these families who are taking in children as foster children who have not succeeded in a standard foster care home. So the children are brought to Starlight Pediatrics, where they receive care from a pediatrician and nurse practitioners for their medical care needs.
Okay, thank you for that so much. And so I guess what kind of threw off what's going on with this is the Starlight. I mean, you definitely explained. It sounds like we contract with our service for these services to be provided, but the Starlight is located. That's kind of what threw me off in Massachusetts, right? The North American Family Institute. So, can you tell me, please, through you, Madam Chair, to the administration, how this works, how it relates, or what is this Massachusetts address?
Through the chair, the National American Family Institute has multi-state locations. Their main headquarters is based in Massachusetts, but they also provide services in New York State. And they are contracted through our Department of Human Services to provide these services to children who are in foster care in Monroe County. So they provide the similar services to what Hillside does to children who are residents of Monroe County. Does that answer your question?
Mm-hmm. Thank you so much. And thank you.
Legislator Conley?
Thank you through the chair to the administration. Are the children who are in the therapeutic foster homes, are they children who were originally children who resided in Monroe County, or are there some children that are in these foster homes that are from other counties that have been placed in Monroe County foster homes?
Through the chair, I can't say with certainty. My understanding is that these are children who have parents, biological parents who are Monroe County residents, and that they were placed in foster care through our foster care system in Monroe County. I couldn't guarantee that there wouldn't be some children who might have been placed in foster homes in Monroe County from other places.
Thank you. And through the chair, are the therapeutic foster homes that are certified by North American Family Institute subject to the same certification requirements that Hillside Therapeutic Foster Homes are subject to? Or do the individual agencies set their own certification standards?
Through the chair, each agency has to meet minimum standards that are set by our county and by New York State in order to provide these services to children.
Thank you. Through the chair, are the children in the therapeutic foster homes still available to receive specialized medical care at a psychiatrist's office or a psychologist's office, or what other specialty medical care that they might need, or do they need to receive their psychiatric care through Starlight as well?
Through the chair, Starlight offers primary medical services, and many of the children might be referred to other specialists, including psychiatrists, and so that would be the case for these children as well.
Thank you.
Legislator Cayley?
Madam Chair, through you to the administration, could you just give me a ballpark figure of how long the North American Family Institute has been operating within Monroe County?
Through the chair, they have recently contracted with our Department of Human Services, and they have not begun enrolling children in their therapeutic foster care program in Monroe County yet. It's anticipated that they will begin enrolling children in April of this year.
Thank you. Then, just to be clear through the chair, is this their first year of operation in the area, or their first year of contracting with Monroe County in the area?
Through the chair, I am not certain. I think I could probably get you that answer, but I don't know for sure.
I would appreciate that very much. Thank you.
Thank you. Any other discussion? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Are there any other matters to come before the committee? Being none, Being no other matters, the February 23rd, 2016 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held Tuesday, March 22nd, 2016 at 5:30 p.m.